Good morning everyone. I hope you all are doing well. My name is Dr. Amar Kumar De and I am excited to welcome you to today's session titled Cardiac Output Measurement. It's exciting to see so many of you joining us from different corners of the world. First and foremost, I want to extend a warm thanks for taking the time to be a part of this session. So, without further ado, let's embark on the exploration of cardiac output measurement. Here's a quick overview of today's session on cardiac output measurement. First of all, we will have the introduction to cardiac output measurement. In this, we will cover the meaning of the cardiac output and its importance in assessing heart function. Secondly, we will take the cardiac output measurement significances in assessing heart functions and overall circulatory health. After covering the fundamentals, we move on to the types of the cardiac output measurement. In this, we will present various methods for measuring cardiac outputs such as thermodilution, flicker method and impedance cardiography. Here we describe how each methods work and discuss their advantages, limitations and applications. Then we will discuss the precautions and accurate cardiac output measurement techniques. Then we will focus on the applications of cardiac output measurement. Finally, we will conclude the session by summarizing the key takeaway from this session. Let's dive into the introduction part. We start with the cardiac output definition. Cardiac output refers to the volume of blood pumped by heart per unit of time, typically measured in liters per minute. It's a vital physiological parameter that qualifies the efficiency with which the heart is pumping blood to meet the body metabolic demands. Now, let's take a look into the importance of this cardiac output measurement. The cardiac output holds immense significance in understanding the cardiovascular health and overall physiological functions. Here's why it's such an important parameter. The primary function of the cardiovascular system is to deliver oxygen and essential nutrients to various tissues and organs throughout the body. Cardiac output directly influences the amount of the oxygen rich blood reaching these tissues, ensuring their proper functions and survival. The second reason is, in addition to delivering oxygen and nutrient, the circulatory system also help removing waste products such as carbon dioxide from the body, and adequate cardiac output is necessary to efficiently transport this waste product to the organ responsible for their elimination. The next reason is, cardiac output serves as an indicator of heart performance. Consistently low or high cardiac output can suggest potential issues with heart functioning. Monitoring changes in cardiac output can help diagnose and manage heart conditions such as heart failure and arrhythmias. During physical activities, the body demands for oxygen and nutrients increases. As higher cardiac output ensures that enough blood is delivered to active muscles to support their heightened metabolic needs. Athletes and individuals engaged in physical training often have higher cardiac outputs. In critical care settings, monitoring cardiac output is crucial for patients with severe illness or undergoing surgeries. It helps healthcare professionals assess the impact of medical interventions, medications and treatment on circulatory functions. Cardiac output is an essential parameter for determining the approach, doses of medications that affect the circulatory systems, as it helps predicting how quickly a drug will be distributed throughout the body. Maintaining a stable cardiac output is vital for hemodynamic stability, the balance between the heart pumping ability and the body demands for blood fluid. Any significant deviation from normal cardiac output can lead to compromised organ function. In summary, cardiac output is a fundamental measurement of heart efficiency in pumping blood to meet the body demands. It has broad implications for overall health, exercise tolerance, medical interventions and critical care management. Understanding and monitoring cardiac output is essential for cardiovascular health and maintaining proper physiological function. Now, let us focus on cardiac output measurement significances in assessing heart function and overall circulatory health. It is an important parameter for assessing heart functions. Cardiac output measurement provide a direct insight into how effectively the heart is pumping the blood. A normal cardiac output indicates that the heart is capable of maintaining an adequate blood flow to meet the body metabolic demands. Cardiac output is closely related to stroke volumes, which is the amount of blood ejected from the heart with each beat. By measuring the cardiac output, one can indirectly assess stroke volume, a key indicator of heart ability to contract and pump efficiently. Variation in cardiac output can signal potential heart issues. A decreased cardiac output might indicate heart failure, cardiac arrhythmias or other conditions affecting the heart's pumping ability. Cardiac output measurement is also helpful in predicting the overall circulatory health. Cardiac outputs plays a vital role in delivering oxygen rich blood to tissues and organ. An adequate cardiac output ensures that organ receives sufficient oxygen and nutrients for optimal function. Reduced cardiac output can lead to tissues low oxygen level, potentially compromising organ health. Cardiac outputs is linked to blood pressure regulation. A decreased cardiac output can trigger compensatory mechanism such as increased heart rate and vasoconstrictions to maintain blood pressures. This mechanism, if prolonged, can strain the heart and contribute to hypertension. Monitoring cardiac output help in assessing the fluid status. High cardiac output might indicate excess fluid volume, while low cardiac output might suggest fluid deficiencies. Adjusting fluid administrations based on cardiac output measurement can optimize patient management. Cardiac output measurement provides a feedback on effectiveness of medical interventions after treatment or surgery. Change in cardiac output can indicate whether the interventions has positively impacted circulatory health. In critical care scenario, cardiac output measurements offers prognostics information. Individual variations in the cardiac output impacts drug distribution and metabolism. Accurate measurement help tailor medications doses to each patient circulatory profile, enhancing treatment precisions. In summary, cardiac output measurement is a cornerstone in evaluating the heart functions and overall circulatory health. It aids in detecting the cardiac abnormalities, assessing the tissues oxygenation, regulating blood pressures, managing fluid balances and guiding medical interventions. By understanding and utilizing the cardiac output measurement healthcare professionals can make decisions to prompt cardiovascular well-being and enhance patient care. Now next, let us discuss the factors that influences the cardiac output, including the heart rate and the stroke volumes. The key components that determine the cardiac outputs are: the first one is the heart rate, which refers to the number of times the heart contracts in a minute. It influenced by various factors. The first factor is the autonomic nervous system. The autonomic nervous systems plays a significant role in regulating heart rate. The second factor is the hormones. Hormones are released during stress or exercise, increases the heart rate. Thyroid hormones also influence heart rate by affecting the sensitivity of the heart to these neurotransmitters. The third factor is the fitness levels and age. Regular exercise can lead to a lower resting heart rate in well conditioned individuals. Age can also impact heart rate, with infant having higher heart rates than adults. The fourth factor is the temperature and the environment. Elevated body temperature and hot environment can increase the heart rate as the body attempts to disrupt heart. The second factor that we are going to discuss is a very important factor known as the stroke volume. Stroke volume is the amount of blood ejected from the heart left ventricle with each contraction. Several factors influence stroke volumes are: preload, which refers to the amount of the blood that fills in the heart during relaxation phase. As increase in preload stretches the heart muscles fiber, leading to more forceful contraction and higher stroke volume. Afterload. Afterload is the resistance the blood must overcome to eject the blood into the aorta. Higher afterloads are seen in conditions like hypertension, can reduce stroke volume. Contractility. Contractility is the heart intrinsic ability to contract. An increase in contractility, often due to stimulation or certain medications, can lead to increased stroke volume. There is an important factor which is known as the Frank-Starling law. According to this law, an increase in preload lead to an increase in stroke volume. The heart adjusts its force of contraction based on the amount of blood returns to it. The next factor is the cardiac output. The cardiac output is the product of heart rate and stroke volume. The next factor is the coordination of heart rates and stroke volume. Heart rate and stroke volumes are interrelated and are coordinated by the body to meet its demand. For instance, during exercise, heart rate and stroke volumes supply more oxygen rich blood to the active muscles. Regulations of cardiac output. The body regulates the cardiac output to match metabolic needs. If demand increases, heart rate and stroke volumes can both rise to maintain the adequate blood supply. Conversely, when at rest, cardiac output decreases to conserve energy. Clinical implications. Alteration in heart rate and stroke volume can indicate various health conditions. For instance, a higher heart rate and a lower stroke volume might suggest heart failure. An elevated heart rate without a proportional increase in stroke volume can lead to reduced cardiac output. So, understanding these factors and their influences is crucial for assessing cardiovascular health and diagnosing potential issues. By evaluating heart rate and stroke volume, healthcare professionals can gain insights into the heart efficiency, overall circulatory health and potential areas of concerns. Now, let us highlight the connections between cardiac output and circulatory efficiency. The connection between cardiac output and circulatory efficiency is fundamental to understand how the cardiovascular system functions to meet the body demand. Let us explore this important relationship. The cardiac output, which was defined as the volume of the blood pumped by the heart in 1 minute. Its the product of heart rate, the number of heartbeats per minute, and the stroke volume, the amount of blood ejected with each heartbeat. The next factor is circulatory efficiency. Circulatory efficiency refers to how effectively the cardiovascular system distributes blood through the body to meet metabolic demand. This involves delivering oxygen, nutrients, and removing waste products from tissues and organs. The concepts of circulatory efficiency is closely linked to cardiac output. The next factor is delivery of oxygen and nutrients. Circulatory efficiency ensures that the oxygen-rich blood loaded with nutrient is delivered to tissues and organ. Adequate cardiac output guarantees that enough blood reaches all area of the body, supporting their functions. The next important factor is the waste removal. Efficient circulatory facilitates the removal of the waste products like carbon dioxide and metabolic byproducts from the tissues. The relationship between the cardiac output and circulatory efficiency is dynamic. The body metabolic demands vary based on the activities and needed. During rest, cardiac outputs is low because metabolic demands are reduced. However, during exercise or periods of increased demand, the heart responds by increasing both heart rate and stroke volumes to evaluate the cardiac output. This ensures that tissues received the required amount of nutrients. The circulatory efficiency required a balance between cardiac output and the body metabolic requirement. An excessive high cardiac output can lead to strain on the heart, while a low cardiac output can compromise tissue oxygenation and overall functioning. The cardiovascular system strives to maintain homeostasis, where the body internal environment remains stable. The connection between cardiac output and circulatory efficiency has a clinical implications on heart health. Monitoring cardiac output help assessing the heart pumping efficiency. Deviation from the normal can indicate heart conditions or compromised cardiac output function. In critical care units, maintaining optimal cardiac output is essential to ensure that all organ receives adequate oxygen and nutrient, especially during the period of stress or illness. During exercise performance, circulatory efficiency is critical for exercising performance. Athletes often has high cardiac output to meet the demand of intense physical activities. In a sense, the relationship between the cardiac output and circulatory efficiency highlights how the heart pumping ability influence the distribution of the blood to support cellular activities, oxygenation and nutrient delivery. Understanding the connection is pivotal in assessing cardiovascular health and maintaining overall physiological well-being. Now, let us discuss some of the important methods of measuring the cardiac output, which includes thermodilution, flicker methods and impedance cardiography. We will focus on the working principle of each method, discuss their pros and cons and applications. Let us explore three different methods of measuring the cardiac output: thermodilution, flicker methods and impedance cardiography. Each method has its own working principle, advantages and limitations. So, let us first take the thermodilution method. This method involves injecting a known volume of cold saline solution into a central vein, often the pulmonary artery. As the solution mixes with blood, it causes a temporary decrease in blood temperature. The change in temperature is measured using a thermistor, equipped catheter, and from this change cardiac output is calculated. Pros of this methods are widely used in clinical settings, especially in critically ill patients, provide real-time cardiac output measurement, minimally invasive and can be performed at the bedside. allows for repeated measurement without additional invasiveness. Cons of these methods are required catheterizations, which is sometimes risky, assumes uniform mixing of injected solutions in the blood. Accuracy can be affected by variations in the blood flow patterns and temperature. Applications of these methods are in critical care unit. In intensive critical units, thermodilution is frequently used to monitor the cardiac output in critically ill peoples. The method provides a real-time information about changes in cardiac functions and help guide treatment decisions for patient with various conditions such as heart failure and post-operative care. The next method that we are going to discuss is the flicker method. The working principle of the flicker method is the cardiac output is calculated based on the oxygen consumption and the arteriovenous oxygen content difference. The oxygen consumption is determined by measuring the amount of oxygen enter the body and the amount of leaving the body. The arteriovenous oxygen content difference reflects the oxygen extracted by the tissues. Cons of these methods are provide information on both cardiac output and oxygen consumptions, can be applied in research setting and non-invasively using gas exchange measurement. It does not require catheterizations. Cons of these methods are required accurate measurement of oxygen consumptions and gas exchange, which can be challenging. Assumptions about steady state conditions may limit its applicability in dynamic situations, not suitable for patients with lungs diseases affecting oxygen exchange. The application of these methods are in research studies. The flicker method is oftenly employed to investigate the cardiac functions and oxygen consumptions in controlled setting. Research can study cardiac output responses to different interventions, exercise regimes or physiological conditions, helping to advance our understanding of cardiovascular physiology. Now, the last method that we are going to discuss is the impedance cardiography. The impedance cardiography measures change in thriotic electrical impedances, resistance to the electrical current caused by change in blood volume during the cardiac cycle. Electrodes are placed on the body surfaces and the heartbeat, blood flow variations causes change in the impedances, which are used to estimate stroke volumes and subsequently the cardiac output. Cons of these methods are non-invasive, can be used for continuous monitoring, relatively simple steps and easy to perform, suitable for patient in various clinical conditions. Cons of these methods are less accurate compared to other invasive methods. Variation in body positions and lungs volume can affect the accuracy, may require calibrations against other method for better accuracy. Applications of these methods are home monitoring. Impedance cardiography is suitable for non-invasive and continuous monitoring of cardiac output. It is sometimes used in home settings for patient with chronic heart conditions. This allow individuals to keep track of their cardiac functions and alter health care providers to any sudden change in the alter health care providers to any sudden change that might require medical attentions. Thus, these are the three most commonly used methods for cardiac output measurement. Each method has its own advantages and limitations, making them suitable for different scenarios. The choice of the methods depend on the factors such as the patient condition, the level of invasiveness tolerated, the need for real-time monitoring and the availability of the equipment. By understanding these methods and their principles, healthcare professionals can make informed decisions when assessing cardiac output in various clinical contexts. Now, let us dive into the precautions that need to be taken care and the common sources of errors that ways to minimize inaccuracies. The important precisions and accuracies are: the measurement provided vital insight into patient cardiovascular health and guides clinical decisions. Small error in the measurement can lead to incorrect diagnosis and inappropriate treatment. Thus, maintaining the precision and accuracy is a paramount. The common sources of error and possible minimization will be discussed now. The first factor is the improper catheter positioning. In methods involving catheterization such as thermodilutions, incorrect catheter placement can lead to inaccurate reading. The second factor is the patient movement. Patient movement can disrupt the electrode positioning in non-invasive methods like impedance cardiography. The another factor is the equipment calibration. Incorrect equipment calibration can significantly affect the measurement. One of the important factor is the respiration rate. Rapid or irregular breathing can affect the stroke volume measurements. The next factor is the patient temperature. In thermodilutions, patient temperature affects the accuracy of the temperature measurements. Last but not the least, the data interpretations. Accurate data interpretations is vital. Understanding the principle of the measurement method and nuances of the equipment to correctly analyze the result. In conclusion, achieving accurate cardiac output measurements demands a combination of proper patient positioning, equipment calibrations and various factors. The importance of precision cannot be overstated, and cardiac output measurement influence clinical decisions and patient care. By recognizing the common sources of error and taking necessary precautions, healthcare professional can ensure the cardiac output measurements provide reliable insights into the cardiac health. Now, let us talk of few applications of cardiac output measurements. Here are some key applications. First is the critical care monitoring. In critical care monitoring unit, continuous cardiac output monitoring is essential for managing the hemodynamics stability. During surgical care, cardiac output measurement guides the optimal blood flow to the organ. Heart failure measurement. Patient with heart failure has compromised cardiac functions. Monitoring cardiac output help healthcare provides assess the effectiveness of the treatment regime. Cardiovascular disease evaluation. Cardiac output measurement aids in diagnosing and managing various cardiovascular diseases. Hemodynamic optimization. In patient with lower cardiac output state such as those undergoing major surgeries or experiencing shocks, cardiac output measurement is used to guide interventions aimed at optimizing hemodynamics. Ventilator management. For patients on mechanical ventilations, cardiac output measurements help the ventilation settings to their individual needs. Cardiac rehabilitations. In cardiac rehabilitations program, measuring cardiac output aid in the monitoring patient progress and they recover from heart related conditions or procedure. Athlete assessment. Cardiac output measurement is also used in sports measurement to evaluate athletes' cardiovascular fitness level. Pediatric care. Cardiac output measurement is crucial in pediatric cardiology for assessing the heart functions in children. Pharmacological research and drug development. In pharmacological research, cardiac output measurement are used to evaluate the effect of medications on heart functions. So, it is significant in diagnosing the heart related issues. So, it is a very important factor which need to be taken care of, that is the cardiac output measurement. So, before we conclude, I want to reiterate how much I appreciate your decision to learn and your enthusiasm for today's topic. Your engagement has made my role as educator incredibly fulfilling. Remember that learning is a continuous journey, and I encourage you to explore the topic further and discover the countless opportunities it holds. With that, I do like to thank you once again for joining me today. Your presence and participations has made this lecture a meaningful experience for all of us. I wish you all the best in your academic pursuit and beyond. Thank you and have a fantastic day.